welcome to another edition of the Borno Health Update. I am your host, Ibrahim Amarawa. The program is designed to shed light on the remarkable strides to be made in our healthcare sector under Governor Zulum's visionary leadership. In the program, we focus on the transformative efforts spearheaded by Professor Baba Malamgana, Commissioner of Health and Human Services, who is driving innovations and resilience in our healthcare systems. Severe acute malnutrition has become a devastating crisis in Borno State, a direct consequence of over a decade-long insurgency. However, the state government, under Governor Babagana Umar Zulum, in collaboration with the support from aid agencies, is intensifying its concerted efforts to eradicate this severe problem. In a significant step to tackle this issue, the Borno State government has established a State Council on Nutrition. This marks a crucial and proactive step designed to directly confront this challenge head-on. Deputy Governor Umar Usman Kadafur, who presided over the inauguration of the Nutrition Council, elaborated on the rationale behind its creation and its anticipated impact.
Gathered here not only to inaugurate the State Council on Nutrition, but also to deepen our understanding and commitment through sensitization workshop for the Nutrition 774 initiative. This is an initiative that symbolizes our resolve to ensure that no child, no mother, and no citizen is left behind in fight against malnutrition. Let me use this medium to extend our deepest appreciation to Mr. President for his numerous people-oriented policies and programs across the critical sectors in the states. We equally express our profound gratitude to the Senior Special Assistant to the President on Public Health, Mrs. Uju Rochas, for graciously coming to Maiduguri, Borno State, despite her tight schedule. It is strategically pertinent to note that nutrition is not merely a health concern, it is a foundation for human capital development, economic productivity, educational attainment, and societal stability. A well-nourished child can learn better, grow stronger, and contribute meaningfully to society. Conversely, malnutrition weakens the body, clouds the mind, and undermines the future of communities and nation. This is why we are here today to take decisive coordinated actions that will transform the narrative of nutrition across our dear state. Over the years, Borno State has faced daunting challenges as a result of conflict, displacement, poverty, and limited access to basic services. Yet, through the grace of Almighty Allah and our collective efforts, we have made noteworthy progress in restoring peace, rebuilding communities, and reviving livelihoods. It is now time to consolidate these gains by investing in the most vulnerable and precious segment of our population, our children, mothers, and families. The establishment of the State Council of Nutrition reflects our administration's unwavering commitment to multi-sectoral collaboration. The Council should serve as the highest policy-making body on nutrition, bringing together key ministries of health, agriculture, education, water resources, human affairs, budget and planning, and local government councils, as well as development partners and non-governmental organizations and community leaders together. We will design sustainable strategies, harness resources, monitor progress, and ensure accountability at all levels. The Nutrition 774 initiative, which captures the participation of all the 774 local government areas in Nigeria, provide us with a unique platform to domesticate national priorities, empower stakeholders, and implement community-based interventions that are practical, evidence-driven, culturally acceptable. I urge all the participants to take this workshop seriously, to share knowledge freely, and to live here with renewed zeal and drive meaningful change in every ward, community, and household. Let me assure you all that this administration will continue to invest in nutrition-sensitive and nutrition-specific programs such as maternal and child health, food security, school feeding, clean water, and sanitation. Social protection and empowerment of women will also strengthen data systems, encourage innovation, and work closely with our traditional and religious institutions to promote behavioral change and community ownership. Distinguished participants, the task before us is enormous, but it is not insurmountable. If we work with sincerity, unity, and purpose, we can turn the tide against malnutrition.
During his address, the Commissioner of Health and Human Services, Professor Baba Malam Gana, highlighted the Borno State government's comprehensive strategy to combat malnutrition and enhance health care. He stated that the Zulums-led administration is spearheading several key initiatives. These include the revitalization of primary and secondary healthcare sector, the introduction of SEPA Birth Bundle of Care SBBC, and the maternal mortality reduction innovative initiative introduced by the federal government. All these programs are strategically designed to tackle the crucial issue of maternal and child mortality. Furthermore, the Commissioner emphasized that the newly established Nutrition Council will be instrumental. It will ensure that the issue is receiving the necessary priority and strategic funding within the government's budget to effectively resolve the problem of malnutrition.
It is my singular honor and privilege to welcome you all on this important occasion. In Borno State, we face severe socioeconomic challenges through malnutrition due to over a decade of insurgency which has disrupted livelihoods, displaced the populations, and undermined the food and nutrition systems. Food insecurity remains widespread. Access to farmlands is limited in many local government areas due to insecurity, resulting in low agricultural productivity and independence. The consequences of this are the four pillars of food security, availability, accessibility, utilization, and stability all remain fragile. Malnutrition is multifaceted and is very serious. We have witnessed here in our nutrition hospital here in Maiduguri, numbers of children dying from severe acute malnutrition, especially when it's compounded by infectious diseases varying from malaria to measles, etc. The demographics clearly show that stunting is a big problem, and also in women with reproductive ages, anemia is a problem, where we have at least 50% of some women reproductive age do suffer from anemia. And therefore, it is important that we address the issue of malnutrition squarely. This morning, we're very grateful to His Excellency, the Deputy Governor of Borno State. Despite his very tight schedule, he has been able to commission the Malnutrition Council for Borno State, and I want to say congratulations to us all. The committee also relies on assistance to some extent from partners such as UNICEF, the World Food Programme, FAO, WHO, and other organizations, some of which are present, and we're grateful to them. The State Nutrition Council is finalizing plans to establish its work plan, including ensuring that the nutrition is captured in the state budget, especially in the annual operation plans. Borno State has benefited from multi-faceted help, which included federal departmental partners, which included from the federal, the UNRWA program, and also multi-sectoral food security and nutrition projects of the federal government, including also partners. We have also, in Borno State, established the Safer Birth Bundle of Care and Maternal Mortality Reduction Innovative Initiative, whereby we're integrating nutrition, counseling, and maternal supplementation into our RAMCA program. This included micronutrients, especially in the first trimester or first 3 months of pregnancy. The Nutrition 774 represents a landmark by His Excellency, the Vice President of Federal Republic of Nigeria, where a program has been designed to accelerate progress in reducing malnutrition in Nigeria across all the 774 local government areas. Anchored in the Office of the Vice President and coordinated through Federal Ministry of Budget and Economic Planning, the National Council on Nutrition is an initiative which seeks to improve nutrition at the grassroots level through a multi-sectoral, community-led approach. It strengthens the governance, coordination, and accountability for nutrition at federal, state, and local government levels, improve community access to high-impact nutrition interventions, particularly during the first 1,000 days of life. It enhances financing mechanisms, and it also drives political commitment and leverages on the private sector participation and innovation for local food production. The initiative emphasizes across health, agriculture, education, women affairs, social protection, water, including wash, and therefore it's multi-dimensional. It seeks to operationalize one local government, one nutrition plan. And that is why today we have the representatives of all the 27 local government areas in this hall. This initiative also contributes directly to the renewed hope of Mr. President Bola Ahmed Tinubu, which prioritizes food security, human capital development, and poverty reduction. In light of the above, Your Excellency, sir, I'd like to conclude by saying Borno State remains committed to advancing the nutrition agenda as part of its broader human capital development vision. The government acknowledges the invaluable support of federal government, development partners, and the private sector in reducing malnutrition and improving maternal and child health outcomes. The Nutrition 774 initiative presents a strategic opportunity to build on existing progress, strengthen community-led ownership, and achieve sustainable improvements in food security, nutrition outcomes, ensuring that no child, no woman, or community is left behind.
That was Commissioner for Health, Professor Baba Malam Gana there. Moving forward, the Special Assistant to the President on Public Health, Dr. Ojurochas Anguka, who was in Maiduguri for the inauguration, has articulated the federal government's strategic approach to malnutrition, underscoring its status as a key national concern. Consequently, she affirmed that its eradication is contingent upon a strong collaborative partnership with the subnational governments.
We have come all the way from Abuja under the clear directive of His Excellency, the Vice President of the Federal Republic of Nigeria, Senator Kashim Shettima, GCON, who himself is a very passionate person and passionate about tackling the root causes of poverty under the renewed hope agenda of President Bola Ahmed Tinubu, GCFR. Your Excellency, we are here for one reason and one reason alone: to introduce to you this initiative that touches the nerves of our society, which is also very, very dear to Mr. President. That is the Nutrition 774 initiative. Your Excellency, malnutrition is Nigeria's most silent killer. It does not announce itself with gunfire. It does not trend on social media, yet it slowly kills more dreams than conflict everywhere. 1 in every 3 Nigerian children under 5 is stunted, and nearly half of under 5 deaths are linked to malnutrition. And yes, even here in Borno State, where the land is rich and our people are resilient, we are still losing children silently and needlessly. Imagine a child in Maiduguri, born with brilliance, who never fully develops because malnutrition robbed him of cognitive growth before his first birthday. That child's destiny to become an engineer, the child's destiny to become a doctor or even a deputy governor or a governor is cut short not by war, but by lack of nutrition. Your Excellency, malnutrition is a national emergency hiding in plain sight. It knows no ethnicity, it ignores religious barriers, and it cuts across cultures. It is the language of inequality and poverty, and we must respond with urgency, strategy, and unity. This is where the Nutrition 774 initiative comes in. It is government-led, community-driven, and a result-focused initiative. It is built on 3 pillars. 1, political will at the subnational, because we know that progress requires leadership that is bold and committed. 2 is multi-sectoral collaboration, because no single sector can win this fight alone. Agriculture must provide safe, nutritious foods. Education must raise awareness. Health must treat and prevent. Water and sanitation must ensure safe environment. And social protection must shield our most vulnerable. 3 is financing and accountability, because good intentions are not enough. Budgets must be released on time, funds must be used efficiently, and results must be tracked with real data. Your Excellency, this battle against malnutrition will not be won from Abuja. It will be won here in Borno State, in Maiduguri, in Kanuga, in Woza, in Biu, in Monguno, and in Kaga. And in this fight, our royal fathers who are here and religious leaders constitute the advisory council, providing daily guidance. You carry the weight of tradition and the trust of the people. The local government chairmen who are here seated are captains. You will lead this tactical units, identifying vulnerable households, mobilizing communities and ensuring interventions reach the grassroots where they matter the most. But every captain needs a commander. Your Excellency, as the state governor, you are the Major General and General Officer commanding of this war. You hold the authority and the political will to drive systematic change. And Your Excellency, with your leadership, we can coordinate these forces and turn the tide. You have the power to convene sectors and allocate budgets and inspire actions. We are not here to impose a federal template, Your Excellency. We are here to support Borno-led solutions because Nutrition 774 thrives on ownership and contextual solutions. Your state knows its realities better than anyone else does. And Nutrition 774 is a Borno initiative designed by you, shaped by your people, and driven by your own priorities. Our role is to support you with policy tools, technical expertise, and partnerships. We want Borno to own this initiative. We want Borno State to champion it and make it a legacy for this administration. Because when a governor invests in nutrition, he's not just feeding children, he is building an army of innovators, workers, entrepreneurs, and leaders. He's laying the foundation for a prosperous Borno State. And Your Excellency, the numbers don't lie. For every $1 invested in nutrition, we have an economic gain of $23. Compare this to $6 for roads and infrastructure. If we can build roads for cars, surely we can build the brains that will drive those cars. This is why your leadership, Your Excellency, is critical. With a robust state nutrition policy, timely budget release, improved coordination across sectors, and mechanisms for accountability, Borno can become a model for the nation. Our call to action is to integrate nutrition into our agricultural plans, education systems, health programs, and social protection schemes. Let us make nutrition financing predictable and sustainable, not just donor-driven, but government-owned. Your Excellency, history does not remember those who stood by when they could have acted. It only remembers leaders who rose when the stakes were high. Today, Borno State stands at that turning point. Let it be said yes from now, that under Professor Babagana Umar Zulu, the executive governor of Borno State, that Borno became a leading example, breaking the chains of malnutrition and unlocking a future of greatness. Let this be your legacy, Your Excellency. And with that, I say thank you, and God bless Borno State, and God bless the Federal Republic of Nigeria.
The dedicated work of the Ministry of Health and its partner agencies has yielded a significant result. Borno State has been named the top performer in the country's immunization plus project. Borno State has been emerged as the overall best in the implementation of immunization plus and malaria progress by accelerating coverage and transforming services impact, surpassing other participating states across the country. Impact is a World Bank-supported community-driven project aimed at reducing by the half mortality of children under 5 by 2030 through strengthening the primary healthcare centers. The project delivers integrated immunization plus and malaria services to vulnerable population across 335 primary and secondary healthcare facilities across the state. Receiving the award at the Government House in Maiduguri, Borno State Governor Professor Babagana Umar Azulum commended the effort of the Minister of Health for achieving the milestone. Governor Azulum reaffirmed his administration's commitment to continue its investment in the healthcare sector to improve the well-being of people of the state. The governor commended the health commissioner, the permanent secretary, the impact project coordinator, and the rest of the team for their effort in achieving this feat of becoming the best performing state. Presenting the award to the governor, Commissioner of Health and Human Services, Professor Baba Malangana, said the state achieved this feat owing to the high performance in the implementation of the project in a holistic and coordinated approach, deployment of digital monitoring tools, as well as data quality. He reminded that more than 2 million anti-malaria drugs, 2 million test kits, and other essential consumables has been distributed in the last 1 year. Our big congratulations to the Borno State for this milestone achievement. Well, viewers, with this, we have come to the end of this week's edition of the Borno Health Update. Join us next week for another edition of the program. Until then, I'm Ibrahim Amara reminding you, health is wealth, and Borno is on the rise.